Hi guys. Yeah, so this is another vlog in the same clothes. So hii ni ukuta ya ploti yetu. So yeah, so hi guys, welcome to this vlog. So today's vlog is about rating my clinical rotations. I was supposed to do this vlog with Evans, but I don't think he will join us because I don't know why he does not. So me, I'm gonna do a solo rating clinical rotations. Yeah, so our first rotation, we go to rotations in 1.2 for like, we did ours at 6 weeks, for 6 weeks for semester year 1 semester 2. And yeah, so we first went to PNC is postnatal care. Hapa ni postnatal coverage, I think it's care. So yeah, so hapo like we used to like sukuma wa mama kutoka CS, and you monitor eclampsia mothers. You monitor them, you were unawasukuma kutoka gyne ward. Yeah, there was someone peeping. Gyne ward. Yeah, and you give medications, you monitor them, you give them health education. Yeah, we used to do OBS every 3 p.m. and every 9 p.m. and every at night. So would rate it 4 out of 10. Yeah, but after that we went to PEDS, and PEDS was because lots of people over in this area die of sepsis because of gum cutting, which is very common in this area. Yeah, so over there you would see children dying, which is not even it's not even a laughing matter. So yeah, but I really enjoyed PEDS, and this calculation of drugs in PEDS. And in kwanza PEDS unatumia floxapen, you calculate it, and Xpen. And in PNC ward we used not to calculate drugs. We actually used ceftriaxone majorly, and we used not to calculate it. You just dilute it, 2 grams of cef, you just dilute it. Yeah, so PEDS I would rate it 5 out of 10, actually a 6 out of 10. It was good. So after that we went to school, and then so for year 2 semester 1 we went to male surgical theater, and this was at the not theater ward, it was combined both surgical people who wanted surgical attention who are male, and the people who had orthopedic issues. It sounds bad, but yeah, so there it wasn't that bad. Like, the ward was smelling because it's wanaume majorly, and they can't pay because they are having a traction. Traction is when you're done, or if I'll just put an image over here. I'll search for traction and put an image over here. So yeah, so did I enjoy it? The workforce was actually so low because you would manage that more than 30 patients, sometimes even 40 patients, and it was 1 nurse, 2 students. So I'm imagining if it was only the nurse, you unawaosha, you would dress their wounds, help them eat because some of them could not eat. Unawatoa kutoka operating theater. Yeah, I don't remember anything else. You monitor them, and some of them were from a road accident, so you also give them medication. It was the workforce. Lakini nilikuwa nasimama hapo, like at the end of my shift my back hurts because that, imagine giving 30 patients. You first go for the doctor's ward round for 30 patients or more than 30 patients, and then you like wapea dawa wote, and then you unawaosha vidonda wote. It was so tough. Yeah, I would rate it at 6 out of 10 too, because I experienced that nurses literally have low workforce. Like, it would be 1 against 30. Imagine. So yeah. And then after there we went to female medical. Yeah, female medical. There we were done our total nursing care 1. Yeah. Female medical was Our female medical is a gynecological ward and also a medical ward. So a lot of people, I saw people dying in female med. That is actually traumatizing. So the cubes were divided, so you could see someone with hypertension, someone with diabetes, someone with both, someone with sepsis. Yeah, just knowing that they were women, all of them, it was so traumatizing seeing them die. So yeah, so we were managing those conditions. Like I did not get to manage diabetes ketoacidosis, but I remember managing diabetes crisis, if there is something. No, I think it's called hypoglycemia. Yeah, even in male surgery, I managed hypoglycemia, but here you would manage hypoglycemia like 3 times in your shift, and wash people's feet. There was also wound cleaning in male surg, wound cleaning. In female medical there was wound cleaning because the diabetic patients always have foot wounds. Yeah, so there was wound cleaning. I saw someone in a coma, like not even one person. Like, it was so traumatizing, and the family is there. I also experienced for the first time Graves' disease. So Graves' disease is like goiter. It's a hyperthyroidism disorder. Yeah, I would rate it I would rate it 4 out of 10, and the reason is the we used to like go to shift at 7 na unatoka 3, alafu mtu wa AM ataingia saa 6 atoke saa 12. So it is not like balancing to me. Mtu wa asubuhi anafanya kazi mingi na anatoka late, na mtu wa lunch anafanya kazi ndogo na anatoka, like it was not balancing for me. That's the reason why I've rated a 4. But I even managed HIV patients, meningitis patients. I wasn't alone, I was with a nurse. Yeah, it was nice. Like, there was a new experience over there. So after female surgery, I think we went back to school. No, I think we were returned to PNC. Yeah, so in PNC, so I won't repeat PNC because I've already talked about it, but we would also palpate the mother's abdomen and skiza fetal heart rate. Yeah, so I've already rated it. So the next, in 2.2, we went to MCH for the first time, and MCH was amazing because your job as a nurse is to administer drugs, and there you would administer lots and lots and lots and lots of IM drugs, immunizations to babies. Hurting babies was not that good, but administering them, like, it was good. So the only challenge that is there in MCH is like knowing where to administer the drug. So yeah, but for the immunization part, I would rate it a 7 or a 6. Let me rate it at 6 out of 10. Yeah, it was so nice. It was so nice. Yeah, so if you see me looking this way, there's a door over there. So yeah, so the next one that I would administer, okay, so the next in MCH, in MCH you go for immunization and plus assessment of pregnant women, And assessment of pregnant women, you would give them folic acid, palpate. If mama anakuja na akisikia vibaya, you would like take them to the matwing, and we have never rotated in the matwing, so that was nice. Yeah, that was nice. So assessment, I would give it a 5 out of 10. I did not enjoy it, but yeah. So after that we went to operating theater, and that one I would give it a solid 7 out of 10. So 7 out of 10. Why? Because it was amazing, like just seeing mtu anafunguliwa, anakatwa, alafu you see the manyama, you fix them, you help in anesthesiology. It was amazing. Kukata gozes wasn't amazing, but the other part was so amazing. I really loved it there. So it was a solid 7 out of 10, and we used to be fed, side note. Yeah, so ugaramki food, so I would give it a 7 out of 10. For main, that was a trauma theater. After that we went to gynecological theater, and I would give it, oops, nimetoa kitu hapa. I would rate it, for gynecological theater, I would rate it, I think a 6 out of 10, even if the experience over there was so nice. Our anesthesiologist was so nice. She would teach us things compared to the anesthesiologist who was in trauma theater. This one was so nice, and she was a she, so this one was so nice. She would even show us how to do a spinal anesthesia. Yeah, so I really enjoyed it, but I would still give it a 6 because of some nasty, some nurses were rude to us, but I would give it a 6. I even managed a patient who had high blood pressures after the operation, and I was so happy. Yeah, I would give it a 7. So that's it for today. See you in the next one. Bye.